All right. So the client I chose is the 41-year-old female, and she's reporting PMS, mood swings, breast tenderness, and bloating, constipation 3 to 4 days per week. She drinks wine most nights, has a low protein breakfast, a high stress job, and her genetic report mentions methylation and detoxification SNPs. So, looking at this, the pathways that seem like they are most relevant are the adrenals with cortisol and sex hormones, um, anything that affects the sex hormones. So, the next question, of course, is what current lifestyle factors may be creating extra burden? Well, most of them. The drinking wine most nights, definitely. That it can be causing a lot of things, including dehydration, disrupted sleep, the low protein breakfast. It's not helping her stay satiated throughout the day. And we all know at age 41, you're heading into perimenopause, you need the protein. The high stress job is not being helped by the drinking. It's not being helped by the PMS. It's not being helped by constipation. And the next thing would be I would ask her about her bowel movements, first of all. How often are you going? It says you're constipated 3 to 4 days a week. What does that mean? How often do you go? What is the quality? Is it soft? Is it hard? Is it painful? What are the symptoms of your PMS? When does it start in your cycle? How severe are they? How long does it last? The next question would be how much alcohol are you drinking? You say wine most nights. How much? Is it at dinner? Is it before bed? The next one would be your sleep. How much sleep? What's the quality of your sleep? Do you go to sleep and stay asleep? Do you wake up through the evening? Do you sleep 4 hours, 8 hours, 6 hours? Do you have a regular bedtime and a regular time to wake up? And then nutrition. What is your typical diet like per day? Um, what are your eating patterns? And or is this pattern of eating and the foods you eat, are they consistent during the weekdays and the weekends, or is there a bigger difference? So the foundational recommendations that I would look at would be, first of all, sleep. Let's introduce sleep hygiene. Let's reduce screens 2 to 3 hours before bed. Stop food intake 3 hours prior to bedtime as much as possible, and create a relaxation process prior to bedtime, which could include breathing, could even include some gentle walking if that's a possibility. Also, to look at maybe an Epsom salt bath as a relaxation process also can help with putting a little bit of magnesium into the system. The second recommendation would be to decrease the alcohol consumption because it is sleep disruptive. It can affect detoxification and it can be dehydrating. This third one would be to increase her fluid intake safely, making sure there's electrolytes in the water, not just having lots and lots of water. And that can go hand in glove with the alcohol decrease. So less dehydration from the alcohol, more hydration from appropriate fluid intake. And then the fourth and fifth, they're kind of together, would be to increase her protein intake with a goal of perhaps 30 grams of protein in the morning as a breakfast, and to increase fiber, a little more fresh fruits and vegetables, and maybe introduce a 20 to 30-minute walk if possible, maybe to break up her stressful job during the day as a form of stress reduction. So that those are the foundational recommendations. Now, the symptoms and biomarkers I would want tracked. First of all, would be sleep. I want her to log her sleep. I want her to log how many, if at all, she's waking up during the night, the time she's going to bed, the time she's going to sleep, to see if it changes. The second thing I would like her to track is her bowel movements, or is she constipated less days? And is the quality better? And the next one would also be to track and notice the PMS symptoms. Are they decreasing? Are they increasing? Is the length that she's having these PMS symptoms getting worse or better? And the last one would be also to just notice how she feels. How is your stress level? Do you feel like you're less stressed from work? And and let's look at your skin. Is your skin showing anything from detoxification? And then when would I refer out? I would refer out if she's reporting that especially if she's starting to report that the constipation's getting worse, or if it's at least not getting better, or if it's getting worse, if it's painful, that would be a referral. The next one to me would be if she says, I cannot stop drinking, just can't do it. I can't even reduce it. That would be, that's out of my league. And the last one would be PMS symptoms. If they're not getting better and they're getting worse, perimenopause is a thing, and I would think referral for more hormone follow up and with somebody who could also do more with the hormones would be recommended. And that's me, Theresa Veit-Harmening.